Hello everyone. Welcome back to Thrive Alive. I am your host, Nurse Jazmine, and our special guest today is Dr. John Martin. Dr. Martin is a bioengineer by training with a research focus in degeneration, regeneration, and physical function. He primarily focuses on the spine. His research group develops medical imaging and data science tools to link joint disease and patient factors for a holistic view of disease. Currently, Dr. Martin's work evaluates how socioeconomic factors and physical fitness are related to spine disease and low back pain. Today, we will be talking with Dr. Martin about spinal health, physical function, and the surprising factors that may contribute to effective pain management. Dr. Martin, welcome to Thrive Alive.
Well, thanks so much. Thanks so much for having me. Yeah, it was an honor.
Yes, how you feeling? How's your day going?
Feeling good. I'm nervous and it's hot out, but I'm here and I'm very excited to be here. Thank you for having me. Yeah.
We are so thrilled to have you. But before we get started, we have some really good, juicy spinal stuff to talk about today. But before we get started, I want to start with a statistic. So according to the 2019 National Health Interview Survey, more than 1 in 5 American adults live with chronic pain. More than 1 in 5, that's a lot. That is why we have Thrive Alive. That is why we are bringing professionals like Dr. Martin to talk to the community about these things, because we tend to not realize how much we're affected by things like pain. So, Dr. Martin, before we get into your background, I want you to help us address some common myths about chronic pain.
Sounds good.
So, we took a poll, all right? We polled you guys. We asked the community a few true and false questions. So we're going to go through those and we're going to get Dr. Martin's perspective. So, first question, true or false, work injuries are the leading cause of chronic back pain in American adults? Before you answer, I just want to let you know, most of the community, 70%, answered true.
Oh, interesting.
So the question again, work injuries are the leading cause of chronic back pain in American adults. You guys think the answer is true. What do you think, Dr. Martin?
I think the answer is false.
Okay. I think you're right.
Yeah, okay, good.
Let's trust the expert. So would you be able to tell us what is the leading cause of chronic back pain?
Well, so back pain we consider a biopsychosocial disease. There are many factors that contribute to back pain. Employment and manual labor, that's one contributing factor. Physical health of your spine, that's another factor. But there's also a mental health component of it too. So I can't really tell you which is the most effective or most important for back pain. In our work, we found we did a big study of many variables that contribute to back pain. We found that income and education were the biggest drivers of back pain.
Wow.
So manual labor is definitely a part of it, but we don't know exactly how it's related.
Right. And we can't necessarily say that that's the leading cause. No, that's the main cause. You got people that have office jobs that suffer from back pain.
Yeah, we know. Yeah, we know from many studies in animals and humans that if you don't move your spine, if you're stuck in a chair all day, it'll slowly start to degenerate. Yeah.
So the saying is true: if you don't use it, you lose it.
And in the musculoskeletal system, that's definitely true. Yeah. In your joints, that's definitely true. Yeah.
Wow, I'm glad you brought up studying animals, because I have a question about that later, but I want to stay on track. But that's very interesting. I can't wait to talk about that. So the second question, true or false, opioids should be the first treatment option considered for patients experiencing chronic and acute pain. Most of the people in the community, 90%, say that is false. What do you think?
Yeah, do not use opioids as a first line of defense for pain. Very, very bad idea. Very bad idea.
Okay.
And, one thing I would like to say is that back pain is kind of divided into two groups: acute pain and chronic pain. And most people who show up to the doctor, they have acute pain. Their pain, they're really they're in a really bad state. They can't move. They're in a lot of pain. But most people's pain will go away in 3 months. We don't know why that happens, but that's a very common finding. People who go on for longer than 3 months, that's a different category of pain. That's called chronic pain.
Okay.
And so for acute pain, no opioids. For chronic pain, the data on opioids suggests that it's not helpful either. So.
Wow.
Yeah.
Neither for acute or chronic pain.
No. Yeah.
Wow. That is very interesting. So I just want to confirm what you said for those of you who may not understand the difference between acute and chronic. Acute is lasting 3 months or less.
Yes. Yeah.
And chronic is 3 months or more.
Yeah.
Okay.
Yeah.
Got it. Okay. All right. So next question. Non-invasive treatments like acupuncture and chiropractic care are recommended over surgery for back pain. 73% of members of the community agree that that is true. Non-invasive treatments like acupuncture and chiropractic care are recommended over surgery for back pain.
Yeah, that's true.
Okay.
Yeah. If you have back pain, you don't have, and just back pain, you don't have radiating pain down your leg, then you probably shouldn't have surgery, except in some rare cases. So, we call this kind of pain, if you have back pain, if you have chronic back pain, and then you go in for an MRI or an X-ray, and they find like a broken bone or something, well then you gotta get that taken care of.
Right, of course.
That's like a smaller number of the cases. Most people have this kind of non-specific back pain. They have a lot of pain. They can't find out they don't see anything wrong with their spine, and so you should not have surgery in that case. Yeah.
Wow. I personally know a couple of people who suffer from chronic back pain that have had doctors recommend surgery for them. And I don't know, I don't know like their medical history or anything, but it's just interesting because I kind of always thought that was the first thing doctors recommend for back pain.
Yeah, I mean, so the new recommendations came out like maybe 5 years ago, and like in what you're saying, that was probably true. Like back then, a lot of people were recommending, a lot more people were recommending back pain, but turns out like the effects of just these less invasive things like acupuncture or meditation or yoga or exercise, there's some mental health training that you can do. Those are equally effective or more as surgery. And so because they're non-invasive, they're kind of preferred, yeah.
Okay, so you mean to tell me that I can do yoga and meditation, something that don't cost a thing. Yeah. I can do it at home in the comfort of my own home, can help alleviate pain.
Yeah. So it's not going to work for everyone. It'll work for some people.
Wow.
But you'd rather do that than get surgery.
Wow.
Yeah.
Interesting. That's good.
Yeah.
That's good. Can I ask you? I'm not sure if you can answer this, but can I ask you why something like meditation or yoga works? Would you be able to answer that?
That's not I don't know.
Okay.
Yeah, but
it just works.
Yeah, I think I guess one of my my opinion on how to, like, if you're, some people have pain, chronic pain, and they get bounced around from doctor to doctor to doctor to doctor. And one doctor says, I can't help you, go see this doctor. We think that person can help you. That doctor says, I can't help you, go see this doctor. And so you get stuck in this kind of vicious cycle of bouncing around by doctors. I think you really have to take control of your pain. You have to really empower yourself to seek out these alternative methods. And not all of them will work for you, but you may find that something works for you. And if it works for you, then that's your treatment.
Right.
Keep doing it. Yeah.
Interesting.
Yeah.
Wow, that's good. So you guys need to start stretching. Close your eyes sometimes. Get your Zen on.
Yep. Yep.
Okay. So last true or false question. Race is the top predictor of pain severity. 62.5% of our community members say that is false. Race is the top predictor of pain severity.
Yeah, in our data, race was not the top predictor. It was up there. Income and education were the top predictors. Race was a little bit further down, but race is a part of it, but I don't think it's the primary factor.
Okay.
And it's not a biological reason. Race is a social construct, so it's tied in with income and education and those kinds of things, but it's not the biggest predictor. Yeah.
Okay. Now, can I ask you? I'm sorry to keep asking you why, but income and education. Can you give me like some of your thoughts on why you think?
Well, we have a lot of thoughts on this, and we're actively studying this in the lab right now. We don't know for sure. Some of the things that we're looking into are, for example, for some reason, do people with low income do they have disease in their spine? We wouldn't necessarily know why, but we're looking into that specifically, whether they have like more disease than somebody who's not. Some of the factors could be nutrition. So in Chicago, it's kind of famous for having these huge food deserts where people don't have access to healthy food, and perhaps that's why they don't get the right nutrition. Their cells can't produce the right tissues, and then your spine kind of degenerates with that. So that could be one. Another thing that we're really interested in is stress. So stress, stress is related. For example, like stress is related to heart disease. High blood pressure causes thickening of your arteries. So that's like a physical change that stress causes.
Wow.
And so we're looking to see if stress causes physical changes in your spine, your musculoskeletal system too. One other factor we're interested in is safe exercise spaces, for example, and access to like exercise and access to sports programs and that kind of thing. If at a young age that you're not active, then perhaps you set yourself up for musculoskeletal disease, joint pain, later down the line.
Right. I think it's interesting. I'm glad you brought that up about like starting to have an active lifestyle at a younger age, because with the pandemic, a lot of schools weren't in, kids weren't getting their physical education classes, and then I think even before that, some physical education classes were like elective, like in some high schools. So I'm just curious, what are your thoughts on that? Like, because I mean, personally, I don't think that should be a choice for like, a young person to choose. I don't want to go to gym. I don't want to take gym.
Yeah. I think, if you're thinking about your long-term musculoskeletal health, you should be active. You should be, should be in gym. Some people just, it's not their thing, and but if it's not, if you don't like to do it in that social context, then get out and like go for a walk later in the day, or find some way to exercise, because we know from lots of studies now that exercise and like loading your joints and your bones, that like keeps your body healthy, that keeps your muscles and your muscles strong, keeps your bones strong, keeps your cartilage healthy. So you really need to do that.
Yeah, absolutely. So it's true. Exercise helps not only with some of the things we talked about previously, like mental health, but it helps with your musculoskeletal system. So, okay, so that was it for the true and false. We are going to move along. We want to hear about you.
Okay.
So here's my question. When I was a kid, I wanted to be an author. I wanted to write books, right? Did you always know that you wanted to do this type of work?
When I was a kid, I had no idea that this job existed, really. So,
interesting.
How I got here, when I was in high school, I tore my ligament in my knee, and I had to have surgery in high school to repair it. And I got interested in musculoskeletal joint health then. I started researching like, why did they do this surgery on me? Not this other option for surgery. And I did some projects in high school related to that, and I continued that into college, and then I got exposed to research as a graduate student, and I realized I really like doing research. It's really challenging. I'm not like reading a book for not like reading information for no purpose. I have a goal. I want to improve like musculoskeletal health in Chicago.
Right.
So I'm trying to read papers that will get me there. So yeah, that's kind of my path
awesome.
here. Yeah.
You were a smart kid in high school.
I did okay. Yeah, I wasn't the top of my class. I did a lot of sports. So I took a lot of my time.
Yeah.
Actually, I wasn't really. I did engineering in college.
Okay.
And I wasn't the top of my class in college or anything. I didn't really get into like academics until I found research, I think, and like it's different. Taking a test just to get an A
right.
is different than like studying a paper to try to figure out how you can help people or how
right.
you can finish an experiment or something like that. So that's really kind of what motivates me. Yeah.
That is awesome. I'm so glad that you brought up. Your goals are very specific. You want to help people in Chicago.
Yeah.
So I want to ask, why Chicago?
Good question. So when I was before I was at Rush, I just started at Rush about, it's been almost a year now.
Oh, okay.
And we did this study during the pandemic when we couldn't do any other research. We looked for data sets to evaluate, and we came up with a new way to evaluate this study, and we found that income and education were the biggest drivers of pain severity for back pain. And so Chicago has some of the biggest disparities in the country, the biggest disparities in the country. And this is the place that needs this kind of information, needs the most help, I think. So that was why Chicago was on the top of my list. Yeah.
Awesome.
Yeah.
Awesome. You could have picked any city in the world.
Yeah.
And you picked the place that.
And they hired me too. That had to do with it too.
Of course. So
it wasn't I wasn't the only person to make a decision there, but yeah.
That's so funny. Okay, so next question I have for you. You actually kind of answered this earlier. You said that you do use animal subjects and you also use human subjects. So my question is, how does using animal test subjects help you understand how the human body works?
That's a good question. We get questions about animal research and the spine particularly a lot because animals walk on 4 legs and we walk on 2 legs. But actually, people have measured this, that you have a similar load, like compressive, like pushing down on your discs and your bones. Similar like metrics once you correct for how big or small the animal is. And it's all the same anatomy. The shape's like a little bit different, but you can learn a lot from animals.
Wow.
Yeah.
Interesting. So even though like a dog walks on 4 legs, their spine is very similar to our spine.
It has has the same bones, same number of bones,
Wow.
and same number of discs, and plus or minus 1. They're differs by animal, but same. You have these small joints behind the disc called the facet joints that can cause pain, and it has the same facet joint structure. And
wow, that's very, very interesting. I personally, when I was studying, I studied biology before I studied nursing, and I worked in a lab with mice.
Oh,
we didn't study the spine or anything, but to be honest, I never really understood. I just knew that was something that you do in science. You study animals. So I'm glad that you were able to explain that, because I never would have thought in a million years that my spine is similar.
And
to
mice mice are really popular because it's easy to manipulate their DNA. It's like really well documented and studied, and how you can do that, and they're improving on that all the time. So mice are studied because you can say we found a gene that's related to back pain, and we want to see how that gene affects that spine. You can change that gene in a mouse, and you can see how it looks, how the mouse spine looks afterwards. So.
Wow. Now
So,
that's cool.
yeah.
That's really cool. Do you work with mice?
I don't work with mice. I have worked with mice in the past, but
Okay.
the work we do is on rats.
I'm sorry.
I know rats have a in Chicago especially, because I almost walked over one last night actually.
Wait,
But,
last night?
Yeah, last night I'm just walking down the street right across my path. Yeah. But yeah, so we use rats because we do a lot of MRI imaging to look at the spine, and so rats are a lot bigger than mice, you know. So they're small enough that you can still do enough that you can make a good study out of. So we use those to do MRI, and actually the rats are very friendly animals. They're used because they're very friendly animals. This specific breeds for research, yeah. You can tickle them; they laugh. Yeah.
Oh my goodness.
And people keep the same strain that we use for the same type of rat that we use for research as pets. Actually, you can go look online for
a research rat.
Yeah.
Like you could specifically request a research rat.
Oh, you couldn't request a research rat, but they breed the rats, for.
Oh my goodness.
Yeah, for pets. Yeah.
Now I'm a Chicago girl, and I can't do rats. And I was thinking about coming to visit your lab, but.
Oh yeah, you should come. You're welcome to come.
You got to put the rats up.
Oh, okay. Yeah, we don't have the rats in the lab. Rush has an animal facility.
So they're stored.
Yeah,
okay.
they're dedicated veterinarians that watch over them and
Okay.
feed them and stuff, and change the cages, and if they get sick, they treat them. So. Yeah.
Wow.
Yeah.
This is really cool.
Yeah.
And you do some really interesting work.
Oh, thank you.
And before I move on to the next question, Dr. Martin and I were speaking earlier, and he let me know that he has students working with him, ranging from high school students to postdoctorate researchers.
Mm-hmm. Yeah.
And I was just letting him know how amazing I think that is, because we don't hear about, especially in certain areas, we don't hear about these type of research studies. So
yeah, I don't have my hands on research much anymore. I basically am a manager, and I write grants, and I write IRB protocols. That's kind of what I do. But yeah, so I manage a lab with we have a high school student, a college student, a postdoctoral researcher, a graduate student, as an engineer. And yeah, it's a management position, but yeah, then I talk about my research too, when people invite me.
Mm-hmm.
Yeah.
Awesome. Okay, so I am going to take a quick break and see if we have any comments. If we have anyone asking questions in the chat. Oh, sorry guys, I'm having some technical difficulties. Okay, it's loading slowly. Well, I'll let that load and come back to that. Oh, there it is, sorry. Okay. Oh, we kind of already answered this question, but I just want to bring it up. One person, Miss Hampton, says her husband had back surgery in the past and still suffers from chronic pain. He's a bus driver and deals with the pain daily. Would the doctor suggest or recommend yoga? That's actually a kind of different question. So is that something that doctors are recommending? Do you know?
I don't think so. Yeah, you would. Maybe you'd hear. What usually happens is you'll, and this person, Ms. Hampton, probably knows that if you'll go to see your primary care doctor, and then they'll say, you tell them you have back pain, they'll say, well, they'll put you in physical therapy, and so that is, that's a good sign. That's a good thing to do, I think. Yeah, go to physical therapy, and then I don't think you may hear that from a physical therapist, but the recommendations are out there to do yoga.
Yeah. So.
Or non-invasive things, yoga, acupuncture, walking, other exercises. Yeah.
Right. So physical therapy is not necessarily yoga, but it is a form of body movement.
Yes.
Which
very
is
good.
a non-invasive treatment
Exactly.
for pain.
Yeah. Yep.
Awesome. Okay, let's see if we can find one more. Ooh. I'm sorry if I'm mispronouncing your name. Zan is asking, does spinal health have an effect on mood?
Oh.
That's a good question.
Yeah, very good question. There's definitely a connection between back pain and depression and anxiety. And it's really difficult to decouple those. Which does your depression trigger your back pain? Does your back pain trigger your depression? But there's definitely a cycle that once you have one or the other, that you can you'll get stuck in this cycle. And not just back pain, any pain really is affected by anxiety and depression. So yeah, there's a really strong connection between those. Yeah.
Wow.
And then I talked about the study that we did, income and education. The next one was depression.
Income and education at the top, depression right under.
Yeah. Yep.
Wow. And income and education can cause depression.
Exactly.
Like everything is like, it's all connected.
Yeah. So it's when one person shows up to the clinic and there's all these potential factors that could drive their back pain. You have a really difficult time as a doctor, trying to sort out like which one of those is causing their pain. So I think that's one of the reasons why it's so hard to treat back pain.
Right. I have a question.
Those are good questions. Very good questions. Yeah.
Let's see. I'm gonna do one more before I ask my question. Is that okay?
Yeah.
Okay. I feel like you already answered. What should we do? Well, you kind of answered this, but I'm just wondering if there's anything in addition to exercise. So Rachel is asking, what should we do every day to prevent back pain?
Every day? Walk every day. Get out of your chair every day. You don't have to go run 10 miles, but get out and walk. It's good for your physical health. It's good for your mental health. Walk with a partner or walk with a buddy. Have a conversation. That's a good place to start.
Okay. And I feel like that's an easy request.
Yeah.
We got to walk from our seat to the bathroom. You know. Do that 30, 40 times and pick up your pace a little bit. And
I would say not just walk like you have to go, like not like you're walking to work and like you're in a rush, but like walking, take some time out of the day to just like go for a walk.
Okay. Like a 30-minute minimum, like
casual walk.
Okay.
To clear your head, talk to your friends.
Yeah. Wow, that's very good advice.
Push your kid in the stroller. Yeah.
Right. Good for them too. Maybe
Yeah, definitely.
You got a hollering baby at home.
Yeah.
It does work.
Yeah, that's
take them out.
That's
push
my
them
trick.
around.
Yeah.
Okay. So earlier we discussed how non-invasive treatments. Wait a minute. Wait a minute. I'm not ready to wrap up yet. Hold on. Wait a minute. I have a personal question. Okay. So a friend of mine and I were talking, and we're both breast cancer survivors. I know your research is not necessarily in cancer research, but I'm wondering, because there's so many factors that contribute to back pain, how do we know that back pain is not something like a reoccurrence? Like, how do we know that it's just like I'm stressed versus a reoccurrence? Because we constantly have that anxiety, in the back of our minds. So, like, is there any tips or opinions you have about that?
If I could make that distinction, whether it's going to recur or not, I would be a millionaire.
Right,
So,
right.
We have in one of our studies we tried to do that prediction. Like that's like a huge question right now in the hospitals in medicine. Is like if you have acute pain, how do we know that you're going to transition to a chronic pain? Or how do you know somebody who shows up at the doctor that says they have pain is going to have pain for a really long time? Because those are the people that it's like 10% of them, but 10% of the people who show up to the doctor end up having chronic pain. And so they get cycled around from doctor to doctor, and they use up all the healthcare resources, and it's a burden to them because they have hope because they're going to the doctor and they're going to get fixed, and then the doctor says they can't help them, and then they say go to this doctor, and then there's hope, and then there's so for the person and for the healthcare system, it's like really bad. So trying to make those predictions, is really important. And like our research says that like right now how much your pain is interfering with your daily activities. That's a good predictor of whether it's going to be chronic. But we did a small kind of pilot study, and we're trying to figure out if that's true now.
Okay.
So if you wake up in the morning and you can't put your clothes on and go to work, or it takes you a long time, then that's a good predictor that your pain is going to become chronic. So at least in our small study, so we're trying to figure out if that's like long-term true in a larger study. Yeah.
That's very interesting. So pay attention to your body. If it's taking you a little bit longer, you can't get that ache to go away, pay attention to that and seek help.
Yeah.
I had another question, but I think I lost it.
Oh,
and
okay.
It was a personal question
Okay.
too. I'm just trying to like soak up everything I can while I have you. Okay, so I think I lost it. I'm so sorry. So earlier we discussed how non-invasive treatments like yoga and acupuncture help alleviate back pain. We teamed up with Dr. Martin to develop a resource for you guys.
Very cool.
Yes. Be sure to download this and other free resources on AliveFaithNetwork.org/resources. And do you have anything else you would like to say to the people before we wrap up?
Yeah, I guess if I want to leave anybody with like one thing about pain is that right now we're not good at treating pain in the hospitals, in the clinics, in your doctor's office, and if you have pain for a long time, you're probably going to get bounced around from doctor to doctor to doctor, and that you really need to empower yourself to take on your pain. So that's a great resource that you put together, because that's one way that people can empower themselves.
Right.
So these non-invasive things are really good first line of defense.
Yes.
For you, rather than getting bounced around from doctor to doctor to doctor,
And getting unnecessary surgeries.
Yeah.
So that's good. First line of defense. I like that. Non-invasive. Think non-invasive. First line of defense. I like that. All right, guys. So thank you so much for joining us, Dr. Martin. That wraps up our third episode of Thrive Alive. We will be taking a short break in August, but we will be back in September. So be sure to follow our socials, follow us on Facebook, subscribe to our YouTube channel. Be sure to subscribe on the Alive Faith Network website so you can get emails and everything. Just stay in contact with us. And we'll see you next time.